It depends on the patient, and we're still trying to find the best way to bring up the conversation. I try to get my staff to start talking about it with the patient when they're being checked in or when they're being shown to a room for their treatment. For me, it's more of an evaluation. When I first see the patient, I look for the lower lying upper eyelids or evidence of a ptotic lid. Then I'll bring up UPNEEQ, and we start talking about other treatment options for around the eyes. I definitely like to emphasize how important it is to have more open eyes, especially as we age.
Let's look at some important safety information for UPNEEQ. There are no contraindications, warnings, and precautions. Ptosis may be associated with neurologic or orbital diseases such as stroke and/or cerebral aneurysm, Horner syndrome, myasthenia gravis, external ophthalmoplegia, orbital infection, and orbital masses. Consideration should be given to these conditions in the presence of ptosis with decreased levator muscle function and/or other neurologic signs. Alpha-adrenergic agonists, as a class, may impact blood pressure. Advise patients with cardiovascular disease, orthostatic hypotension, and/or uncontrolled hypertension or hypotension to seek medical care if their condition worsens. Use with caution in patients with cerebral or coronary insufficiency or Sjögren syndrome. Advise patients to seek medical care if signs and symptoms of potentiation of vascular insufficiency develop. May increase the risk of angle closure glaucoma in patients with untreated narrow angle glaucoma. Advise patients to seek immediate medical care if signs and symptoms of acute narrow angle glaucoma develop. Patients should not touch the tip of the single patient use container to their eye or to any surface in order to avoid eye injury or contamination of the solution. Adverse reactions. Adverse reactions that occurred in 1 to 5% of subjects treated were punctate keratitis, conjunctival hyperemia, dry eye, blurred vision, installation site pain, eye irritation, and headache. Drug interactions. Alpha-adrenergic agonists, as a class, may impact blood pressure. Caution in using drugs such as beta blockers, antihypertensives, and/or cardiac glycosides is advised. Caution should also be exercised in patients receiving alpha-adrenergic receptor antagonists, such as in the treatment of cardiovascular disease or benign prostatic hypertrophy. Caution is advised in patients taking monoamine oxidase inhibitors, which can affect the metabolism and uptake of circulating amines. To report suspected adverse reactions or product complaints, contact RVL Pharmaceuticals at 1-877-482-3788. You may also report suspected adverse reactions to the FDA at 1-800-FDA-1088 or www.fda.gov/medwatch.